is everyone here? I guess some of you guys are like looking at a new career, especially not so much the parents, but their kids. And for those that are a little bit younger, your best years are ahead of you guys. So that's definitely something to look forward to. So a little bit about myself. I'm 33 right now. Been practicing for about 7 years right now as a massage therapist. And I currently am the co-owner of Sutherland-Chan at Women's College Hospital. I've been an owner there for about 3 years. It's been a rewarding 3 years. But just before that, I was also at school at the age of 24 again for massage therapy. I took a 2-year program, and then just walking backwards again. I was a coach for competitive swimming, graduated from university. I swam competitive for most of my life as well. So I've been in the sports field for quite a bit of time. So being a massage therapist was definitely something that was quite rewarding. So going into the field itself, like I said, it's really rewarding and it's fun. Every day, it's definitely something new. Everyone is always excited to see you and meet you because you do a lot to help take away people's troubles. And that goes a lot for like comparing to other professions, like seeing people come in every single day, being happy and like excited to see you. They apologize for being late. And that's definitely something that you don't hear much about too. Because what you do is something special. So I say like, in terms of the profession itself, the schooling is about 2 years, as I mentioned, but you gain such a wealth of knowledge in this. And the knowledge that you gain is very practical and usable every single day. Now, I'm going to ask some of these parents who experiences pain throughout your day. A lot of people do, right? And for those younger ones, I'd say when you hit 30, one day you're just going to wake up with some lower back pain and you're not going to know what to do. But being in this profession, you really gain the knowledge to be able to help those that are around you, your family, your friends. And eventually the friends will actually come up to you being like, oh, what do I do for this? What do I do for my back? And it's great. It's really great. Who watches sports right now? A lot of people watch sports, right? Basketball, hockey. So some of you guys may hear the terms like ACL injury, or I have a tennis elbow or a golfer's elbow. And in being a massage therapist, you gain the skills and knowledge to know what to do in that situation. How can you help this person, or how did that injury happen? But most importantly, through a bit more experience, you know why these injuries happen. And then, of course, as your career builds on and the knowledge you get, you know what to do, how to heal this, and it's able to help people on a day-to-day basis. And the great thing about being a massage therapist, being a chiropractor, physio, is like you know how to heal yourself, because these injuries do lie within yourself. And as you get older, you're like, oh, I have pain here and there. And then you are going to be the person who knows what to do. So it's great. Now, being a massage therapist, there's a bit of a misconception that, all we do is just press on people. But there is like a lot more to that. And it's, again, just being able to know what and why and how to help people that makes this career rewarding. I'm not going to go into too much detail with like what chiros and physios do. But as massage therapists, all our careers have kind of blended together, which is be able to help people in kind of non-invasive ways. Chiropractors focus a bit more with like joint movement, physios focus more on like exercise rehab, and massage therapists focus more on how we engage soft tissue. Um, and then when we engage the soft tissue, it helps everything, the pain release, and it helps the body heal properly as well. So yeah, and of course, like on a day-to-day, like what you can expect in this career would be you greet someone, they tell you about their problems, and you have the clinical knowledge to do assessment, so you can test out why or how an injury happened. You have that knowledge of the over 200 muscles in the body, all the bones in the body, all the ligaments and what each thing does. And then you have the knowledge to be able to treat that. And then also, before they leave, you provide them with exercises on what to do, how to prevent these injuries from happening, how to encourage the healing of these injuries, and then also how to stretch them. So it's a fun career that not many people know about, and it's growing and evolving every day as it's being more demanded on every day. Right now, as you know, I mentioned I work in a hospital. My clinic is in the hospital. We get a lot of doctors, and the doctors, some of them, they don't know the musculoskeletal injuries, which are the injuries in the ligaments as well, or how to test for these. And they do refer to extended health care, which is what we do, physios, massage therapists, and chiropractors, and many more. Now, you're probably wondering what the schooling is like for this career as well. So the schooling for this career, it does range drastically, between 1 year to 3 years. So what makes this career special is in the 1 year program, it's actually a nonstop 12-month program. It requires an undergraduate degree if you want to do the 1 year. The undergraduate degree needs to be relevant in health science or some type of kinesiology degree so that they can apply that knowledge, and you can potentially remove some of the courses in the diploma. In the 2 year program, it's a 16-month program, so it's going to be broken up in 8 months and 8 months. And it's kind of what I went into because my undergraduate degree did not apply over. And then it's a more intensive program as well because it's like Monday to Friday, and then it's 9 a.m. to sometimes 6 to 8 p.m. So it's quite intensive, and you get over like 300, 400 hours of hands-on work and education from some of the greatest teachers too. And then if you want to go into a 3-year program for this, it's generally with a public college as well, and you take additional courses. You're probably thinking kind of what makes this kind of schooling different is it opens many doors. Like I'd say sometimes with physiotherapy and chiropractic, it's a bit more longer. You have 4 years and an additional couple of years afterwards. But then how everything is set up for this is it opens kind of like 3 doors. The first door I would say is massage therapy can be a stepping stone career. So a stepping stone career is it allows you to use this career to get to another point. There's a lot of med school or some people applying to med school who didn't get into med school or didn't get into physio or chiropractic care. And so what they do is they have a relevant undergraduate degree, and within that 1 year, they now develop a license that is able to practice and gain valuable clinical experience that is relevant to what med school students seek or programs seek, what physios and chiro programs seek, because you're literally gaining that experience. communicating with clients and providing treatments and care for that person. And then not to mention, it adds as an extracurricular that schools take into account when they're looking at admissions. And one great thing too is you earn between $60 to $80 per hour with this. And that's going to be your part-time job that you can potentially do on the weekends. And it helps support you to get to where you want to be. This career can also be your primary career, whether that's like straight from high school going into this for your 2 or 3 year program, or after your university degree, and you want to do this, you make enough to really have a good life. And there's lots of courses, and the career is constantly evolving to be better. As long as you're always seeking for more knowledge, there's always more out there. And truthfully, as you get out there and then you're looking for more, you begin to realize that there's always more. And the more you know, the less you actually know. And then I think it was mentioned before in the opening ceremony, like most of the healthcare careers, they actually won't really be replaced by AI or robots, because it does require some type of creativity in what we do. And there are like massage chairs out there, but realistically speaking, they aren't able to provide that care and that focus and the human touch that we can give. Because we affect people not just physically, but we also affect people emotionally, whether it's through stress relief or just injury relief, and being able to give people a chance to play their favorite sport again, or just go back to their day-to-day life. Lastly, this career is also a career that you can take at any point in your life. Again, because of the schooling, it's variable. You're able to jump on it and gain this wealth of knowledge to be able to help people at any point. Whether that point is like next year or 10 years from now, there's always people willing to learn. A bit into the financials too. The program costs about $25,000. And then within your first year of coming out of practice, you would make between 50 to 60,000. And as you get better and you build your clientele or you develop your own practice, your income becomes significantly more in potentially the 6 digits figures. Okay. Of course, you should never look at money as your deciding factor in your career. You always want to make sure that you're having fun in what you do. Money in general will come, but like if you're having fun and you're enjoying what you're doing, it allows you to climb that ladder, that career ladder constantly. I do want to kind of end it off with me saying, like, yeah, I've been in this for a long time. You do need to be adaptive in what you want. You want to be adaptive in your life, and not necessarily just being an RMT, but if you find that, you're climbing your career and then something's kind of going on fire, you need to be adaptive to understand that failing is also okay, but it's like failing forward and like making the changes to get better so you don't constantly fail in that same situation. In general, you just want to be having fun in your life, and so find a career that is fun, okay? I think that's it for me today. Thank you, guys.
Look, good afternoon. My name is Ben Lau, and I'm a chiropractor. I was born in Hong Kong. I went to Texas in 1977. I think you guys were probably not born yet at that time, right? Okay. I went there and I took up petroleum engineering as my career, and then I went to work in as oil company called Pennzoil. I don't know if you guys know that company. If you like cars and motorcycles, and you probably know Pennzoil because they're pretty good with the motor oil. At that time, I worked with the company for about 3-4 years, and my job is that as a petroleum engineer, I went on the oil field and I want to make sure that operation of the drilling is smooth and nothing happens, because if anything happens, you can have a blowout where you lose the well, and you have to drill it back. It'll cost you $10,000 a day. So I have to make sure that things running well. But I'm not the one that does the work. I have a crew with me, and so that I was just overseeing everything. But the thing is that you live in an oil rig, like you're talking about 3-4 hours away from the city, and there's nothing, just trees and trees and trees around you, right? And then I've only 6 people, and for the whole week, I work with only 6 people, and I'm not the one that actually does the work. I just sit there and watch them, right? So that makes life really boring. I find out that I'm not the kind of person. I want to associate with people. And in the 80s, I don't know if you guys remember, you probably not because you're not born yet. When Iraq and Iran, where they were fighting, and they have to sell the oils on the market, in the black market, to make money for the weapons. And that caused a lot of trouble to us because the oil price dropped from $40 a barrel to $9, which if you have to make $20 per barrel to make even, not to make money, but to make even. But it dropped to $9, so that means I lost my job, no more job. So I went up to Canada in the 80s, and I tried to find a job, right? Because I was married, I have a kid at that time, and then I have to make money for the company, right? I mean, for my family. And I tried a year, and I found a job in Medicine Hat, Alberta, with the oil company, and they said I was qualified, but I was not hired. I said, why? She said, because you don't have the Canadian experience. I said, oh, come on. I worked there for 4 years. She said, no, that doesn't count. I said, oh, that's terrible, because I spent 1 year trying to find a job, and I found it, but then they won't hire me. So I said, well, since in that situation, I have no Canadian experience, I have to do something else. So I went in, I looked around, and I found that nursing. I said, that's good because I work with people. Remember, I said I like to work with people, right? And so I tried that. I said, I really like my job. As a nurse, I worked with my patients 8 hours a day, because at that time, the shifts are 8 hours. Now they say it's 12 hours a day, but at that time it's 8 hours. And so I really enjoy my job until my wife, she's a computer analyst. And she worked, as you know, with the computer, you sit all day. See, at that time, you don't have any table called adjustable table. They made it up. They invented it nowadays, but at those times, just sit there and just work with the hands, right? So after a while, about 2-3 years, she developed low back pain. And so she went to get medicines and get treatments and things like that for 2.5 years. The problem was not resolved, and it's still bugging her. So what can we do? So one day a nurse told her that you should try chiropractor. I said, chiropractor, what do they do? I never heard that. I didn't know what they do. So I went with her, and they said, oh, that's interesting, because they don't do any drugs, anything like that, right? They just work by hand, and then she got help. She said, oh, that's wonderful. That's the thing I like. So I tried to apply for it, and luckily I got in, and then here I am, a chiropractor. What we do is that I find that because there are 80% of Canadians have pain trouble. Like 8 out of 10 people has pain, so you can never treat them all because there's just so many people with the pain situation. And then I learned that many of them are taking like medicines and herbs. Now, I'm not saying the medicine is no good. It's good too. But there's sometimes you need to figure out what's causing your trouble. Because if you don't fix a problem, then whatever you do is only temporarily. Like you feel good. Like you put ice on, it feels really good too. You put heat on, it feels really good too. But it's only good for a few hours. And then after that, the pain comes back. And then what next? Are you going to put ice and heat on for the rest of your life? You can do that, right? So there must be a way to find out what's wrong with you and what's causing the trouble. Particularly, you need to know what was the cause of the problem, not just how to fix it, but you need to know what caused the problem. That's my job. I need to find out the situation from a patient, and I have to inform the patient that maybe most probably what is the cause of the problem, so that the patient can prevent these things from happening again. Say if the patient has a bad habit of sitting, like some people they sit with like crossed, right? Some will lean, sideways and things like that. But I don't live with the patient, right? So I don't know. So I have to guess. I have to think what may be the situation, and then I have to tell the patient that maybe that's a situation. And once you tell them this, something could, yes, I did that. And then once they know that, then they can avoid the situation, and you fix them. And then when they are able to avoid the situation, hopefully with the exercises and also with the massage therapists. We work well with the massage therapists too, and the physio. And hopefully then the situation will be under control. Maybe they may need to come back for maintenance, like once a while. They may need to come back to check things out, make sure that everything's still okay. But at least now they will live a life without pain or with minimal pain. Okay, we cannot say sometimes many people say, oh, I have pain everywhere, right? And that's a sad situation. But then I find that if you're able to help people, especially I've had cases where they come in, they couldn't even walk. They were helped to get in, or they may have used a walker, or they may have to be wheeled in. I have situations like that. When my office was in Commerce Gate in second floor before I moved to my new location. And sometimes patients came in, they said, look, my family couldn't walk. So what happens, I have to go and get a chair with the wheels. I have to take the chair down to the car, get a patient in a chair, and then I had to wheel them up because there's elevator, but they cannot walk, right? So I have to do that. And after get a treatment, the patient's going to walk out by himself or herself. I think that's a very encouraging thing for a doctor, because that you have done a job that's a job well done, and that's very satisfying. I find that a professor in my class told us one time, said that as a chiropractor, as a doctor, you want to treat people. Your goal is to make sure that the patient gets help. Remember, you're not there to make a buck, to make money only, because you know that patients are not dumb people. They don't come in just to let you get the wallet, right? So they're smart. So they know if you're there for them or if you're there for the money. Okay, and the professor said that if you care for patients and you help them, your business, your money will come, your business will grow. And I find that the situation, when I care for a patient, when I care for the health, I always tell my patient that I see the whole family, because if you did a good job for them, they will send everybody in, right? So that's a good thing. And then, especially when you thinking about going into profession, you're not thinking about going into profession because of fame or like I'm a doctor, title. I tell you I'm a doctor. That sounds great, but that's not the point. And also, you're not going to be there to make yourself rich. I always tell my patient that as a doctor, if you want to be rich, don't be a doctor. Go to do business. You make money even when you're sleeping. As a doctor, if you're sick, you get take time off. You don't make money. You still have to pay the rent and everything, but you get no money, right? So as a doctor, I think the main thing is that you want to be helping people, especially when the people comes in and they get help and they feel better and they thank you. I always tell the patient that, yeah, you have thanked me for coming for torture because, you know, when you work on them, it hurts a lot. But after pain, they feel better. So they always thank you, say, I like to come in to get more torture, and then thank you for that too. Okay. Anyway, for the profession, the requirement is that you need to have an undergraduate degree, or they may have changed a little bit now because I graduated in 1996. So it's a long, long, long time ago. And they may have changed already a little bit. I think maybe you need to have at least 3 years of undergraduate program. But of course, they prefer you have to have a degree. And then you apply for it, and then you take another 4 years of training, and then there's 1 year of internship. But that 1 year is work, you work in between the third and the fourth year, at the evening, and then also in the summertime. So you don't spend an extra year for the internship. So that's good because you don't want to pay another, because you know how much they charge you, about $24,000 a year for tuition. So you spend $24,000 less because you did the training in between, right? And also after graduation, if you're interested, they have the fellowship program too. So like, for example, you can do sports science where you work mainly with people that got sports injury, like especially with the soccer clubs and things like that. You can make pretty good money and make pretty good name too. Also, you can go into radiology, or you can go to chiropractic science or research and things like that. So that's quite a wide area for you to choose. And according to your interests. Of course, my interest is that I always like to work with people. So I choose to start my own clinic when I graduated, and worked till now. I worked about almost close to 30 years. And I find that the profession is really very rewarding because you're able to help people. And that's the main thing, that when people get help, I feel really happy, especially when you have a tough case comes in and the person had that problem for 30 years. And I have seen many people and I don't get help. And I said, wow, you know, that's a situation. I remember I have one case, is really interesting case. I had a lady, very big lady, about my height, but twice my size, in the 60s. So she's not young, right? And she come in with a walker and also with 2 people holding her side because she had a very bad knee problem. At that time, I was working with my brother. He's an MD, a family doctor, in Hagersfield. It's a small town right close to Hamilton. And that town is only about 2,000 people. So 10 people comes in, 9 of them comes in with knee problems. So at that time, I worked with many knees every day. So I got a bit of experience with that. She came in that day and said, my knee hurts, both knee hurts. And she said that, but the thing is that a year later, my grandson is getting married. Since I'm the eldest in the family, he would invite me for the first dance. Can I dance? She said, wow, big question. I said, I just joking. I was joking. I said that if you can dance, I buy you lunch. And then I worked on her. Oh, she told me that she couldn't take a bath. I said, what do you mean can't take a bath? She said, couldn't walk over the tub because her knee so bad, she couldn't walk over the tub. So just sit by the tub to give herself a sponge bath every night. I said, wow, that's terrible. So I worked with her. And then about 3 months, she told me one time that I took my bath. I said, what do you mean? I said, she was able to walk over the tub now to get her bath. And also about a year later, she called me up and said, I did a first dance already. I said, oh, that's good. You know why? Because I don't have to buy her lunch. Okay. So you see that the profession is very rewarding. You're able to help your patient. They'll give you a lot of rewards, not money-wise, but they'll give you a lot of encouragement. Okay, thank you.
So now we're going to open up the floor to a Q&A. So if you have any questions for Mr. Kenneth NG or Dr. Ben Lau, now is the time to ask.
Yes.
During the work, how do you solve for the relationship with your patient? I mean, challenge someone challenge you. What do you choose? Do you have it?
Yeah, go ahead.
Just to clarify the question, it's that like, how do I cooperate with the client and build a relationship with them? Or
Kind of like a solve.
a difficult, yeah. Well, I guess yeah, like we always encounter new cases, and of course, as you build your experience over time, the difficulty of some cases like begins to reduce just through experience itself. But I'd say with your experience, even when new cases come along or new types of injuries, you can apply them, and yeah, just over time, it does get easier. And then you do build your clientele with that as well. I hope that answered your question. Yeah.
Go ahead.
What techniques, what type of therapy? I come in and I say, I've got some problems with pain. What techniques do I go to the chiropractor and physio? What are the criteria?
What's the criteria?
Yeah.
Oh, actually, physiotherapists and chiropractors work really similarly. We use the same machines. The difference is that as we learn, we practice, we work on joint adjustment. Like sometimes when the joint get jammed up, it hurts. And then we're trying to unlock it. You know, physio, that's the same thing, but we did it differently. And once the alignment's proper, then the pain will calm down. And then you work on the muscles. That comes to the massage therapist. And you work on the muscles and relax them, then hopefully your situation will settle down. Of course, you have to do exercise too, because if you don't, then your problem will come back very quickly. Then you have to keep seeing us. That will make us rich. Okay, back to your question. I had a lady comes in one day. She came in with a tennis elbow. And her son came to me because he played tennis, got tennis elbow. I gave him one treatment, he was well. So she came in to see me to be treated. As I examine her, I tell her what I do, right? And then she start questioning me, oh, is it the proper way to do that? Is it the right way to do that? I say, remember, the doctor-patient relationship is really important. The trust is important. If there's no trust, it's hard to work things out, because if you don't trust you, it's especially it's hard to convince people to get a trust. Anyway, as I examined her, do all the tests, and she could keep questioning if I'm doing it properly. Is it the right way to do that? I have to explain to her patiently. You can't get upset, because if you do, then you're not there for a profession. So I know some people have quick tempers. I know that too, but then we have to learn that. After the treatment, I said, how do you feel? She said, oh, I feel the same. I have no change. It still hurts very bad. I said, maybe I told her that because there's no trust, I don't feel like that she would benefit from my treatment. So I said, maybe you should try go back to get something else like a physio or other, maybe acupuncture, maybe other treatments, something you trust. So she left. And 3 months later, she came back, same trouble. I thought maybe she tried something else and didn't work, and then maybe make up her mind and maybe want to try me one more time. So I gave her the examination because it's 3 months. So I don't know if there's anything changed. So I have to examine her. And she have a same attitude, asking everything that I do if it's proper. I said, oh, come on, you don't trust me, why you come back? And I told myself, I did tell her that, okay? And then after treatment, I said, how do you feel? She said, it's the same, no difference. I said, well, I said that I don't think I can help you. Just try somebody else. Maybe I can't help you anymore. So I sent her out, not because I don't want to see her, but just that she don't trust me. And that's no point. And our case I had is that I had a gentleman comes in with a low back pain. He's quite skeptical. And so I gave her the examination treatment. And luckily, he felt a little bit better. Not much, but a little bit better. So he had a little bit of hope because he had been seeing quite a few people and didn't get help. And then he kept coming in and eventually we were able to fix him up. But he is very skeptical, but because there's some improvement, that's really help him, I mean. But with the lady, she said everything's the same, so I don't think I can. So I tell her to find somebody else. I didn't hear you, sorry.
Is there any volunteer work possible starting grade 10?
Oh, actually, what happened in my clinic, I have patients come in with their kids. Sometimes the kids show a lot of interest. I said, well, in that situation, you can come in to do observation. They can work on patients because they're not even doctors, right? They can't touch anything, not even machines. But I invite them to come in to do observations and they can ask questions. As I work on patients, of course, I have to get my patient's permission first. If they say no, then I cannot just let them stay. Anyway, they come in, they do observations. If they have questions, I'll explain to them why I do that and then what's causing the trouble and things like that. And I have a few patients, I have a few young people like that went into the profession. Because I find that if I'm able to help people, it's good. But then I have only 2 hands. I can work so many people. So I was thinking if I can get more people in, then more, especially the Chinese population or the Oriental population can get help. Especially some of the elderly, they could not speak English. It's hard to communicate with non-Chinese speaking or non-Asian speaking doctors. So that's why I invite the kids to come in to do that, and if they're really interested, then they can try the profession in the future.
Okay, thank you, everyone. Let me present this part to thank you for 2 kind speakers sharing their meaningful experience.
Thank you.
Thank you.
Thank you.
Thank you. I guess there will be 2 more questions.
The gentleman, yeah.
So, question for Dr. Lau, and I saw you from change your career several times, and I'm not exactly sure how old you are.
I'm still young.
In order to be a chiropractor, and not like you jump from registered nurse to actually before that is India, and so if we apply CMCC, we have to have undergraduate degree.
Yes. Oh, actually, you can apply when you're in 3rd year in your university, but you have to have a good grade point average.
Do you think the registered nurse degree of practice your
I tell you what, I was an engineer, and you think that, whoa, that's a very different change. It's not, because as an engineer, I was trying to analyze, to problem solve. So with me working with patients, that's problem solving. I have to analyze the situation, what's causing that and why it comes about, and I have to figure out what's wrong with it. That really helps. And as a nurse, I was trying to communicate. Because you work with the patient 8 hours a day, you have to talk with them. If you cannot communicate, what can you do, right? So as a nurse, I learned how to ask questions to figure out what's wrong with the patient. I guess you guys may have experience when you come see a doctor, sometimes they don't communicate well. you know, and then he said, wow, I want to tell him that, but he's not letting me say everything, right?
Here comes my next question. Do you change the career that you think the chiropractor career is more rewarding than the registered nurse?
No, they both the same because they're helping people, but just your preference only. It's not anyone better than the other one. I believe all professions are equal. As long as your heart is to help people, you can be a housekeeper. Maybe you remember in the few years back when the garbage collector was on strike, we had a lot of trouble. So I think every profession is the same. There's no one better than the other. It's just what you want to do. Welcome. Okay, thank you so much. Oh, last one.
Yes. Yes.
And also as a high school kid, what do you advise that you how to choose to use the software or the wrong way? And one more, to prepare for this curriculum, what we as a high school kid to prepare ourselves getting over.
Yeah, so I guess it ranges from 1 to 3 because of your previous experience. So if you have an undergraduate degree, you could potentially finish it a little bit earlier because they apply your undergraduate studies into the existing program. And then if you don't have relevant programs, so you'll have to take at least a 2 or 3 year. I'd say to get into it, it is, I'd say a college diploma, so you can apply out of high school. But again, it's more of, I think, it depends on what the person wants. And if you take like massage therapy, you can continue to take other courses afterwards as well. But I think like what Ben mentioned, it's whatever sparks joy for you guys. And if you have fun in what you do, you'll always excel in what you do. Okay? Yeah.
How does it affect the future career?
Oh. Mhm. On a technical standpoint, it won't affect your future career, but then the actual quality of the knowledge you get in the 1 year is generally not as good because they do fast track everything. They don't potentially they don't spend enough time into what you need to know. So taking the 2 or 3 year is you get more hours on hands-on hours and more clinical experience before you graduate. So you're able to excel in that career afterwards better. Yeah. Thank you.